So basically, we expect health professionals to be motivated, competent, compassionate, respectful, and caring. To achieve this, there were global and local movements, but still I see that medical humanities has not been yet introduced to the health service system. And introducing this would end up in changing behavior. But the current practice of introducing a compassionate program is based on training, lecture based. So I don't think it is effective as far as what we have in Ethiopia is concerned. So we have the inherent nature of a natural scientist. The natural scientists are really focusing on the science part of any of their activities. Like there could be engineers, there could be medical doctors. So they don't have that luxury of seeing a human being, seeing a society. So behavioral change is very important when it comes to this compassionate and respectful care. So human has right, identity, emotion, creativity, sensibility, and culture. In all our movements, in all our interventions, we have to really think of these important characters of human being. The right, identity, emotion, creative, sensibility, and the cultural aspect of a patient should be really come into picture when we deal with medical care. So this is the inherent nature of a human being. So I would like to take you to what we call illness. Illness is a very broad thing, more than being sick or having a disease. So we have a two part of illness, that is a biomedical aspect, and the other part of illnesses. Because of this, a multidisciplinary intervention is quite required. Discipline that are probably outside of the sphere of medicine. So the other side of illness when it comes, for example, to CLP is we have a very different views, cultural and religious views pertaining to the cause. And sometimes they have a negative connotation. We see also psychological factors in rehabilitation of both parents and the kids. There is a profound stigmatization, and also they have inability to properly interact socially. Their education and vocational part of their life is really compromised. Patients and parents' expectation and satisfaction with intervention is really something that we have to look at, and long-term follow-up, and also the economic burden is very important. These are the other sides of illness when it comes to CLP. It's not just a simple opening on the lip and the palate. So we have two models of disabilities. One is the personal tragedy model of disability and the social model. In the first model, which is widely practiced currently in all societies, that when a person is disabled, something terrible happened to that unfortunate person. And the responsibility is really given to the individual. The society doesn't have any role to play. It doesn't even embrace the individual, and the individual left alone to deal with it. So the social model of disability rather thinks of taking the responsibility of society, and also it considers all human beings equally, despite the presence of disability. Actually, this also focuses also on the nature of the disability. So we have two models, and whatever intervention we are trying to do is really to move from the personal tragedy model to a social model of disability. So humanities, I believe, is a discipline that really bridges medicine humanities that would address also all those things that I have just previously discussed. This is not hard science. It used to be said the study of divinity, then it was called also the study of classics. It really focuses on a critical or speculative way. It is not a natural science per se. When it comes to the concept of care, we need to really emphasize two things: the healing of the soul and the healing of the body.
Please excuse me.
But the current medical practice is really focusing on the healing of the body, because it emphasizes on the biomedical aspect of illness. Yes.
Hello. Yes. Please, we have live translation.
Hello.
Thank you to paste your.
Can you hear me?
Hello.
I can't hear you.
We have live translation from English.
Hello.
Hello, Dr. Atikat.
Yes.
Could you please paste your translation, your presentation?
Am I fast?
Yes, you are.
Hello?
Yes, you are.
Okay.
Okay. Thank you so much.
Okay. So what I am saying is, can you hear me now? Hello?
Dr. Untitled, hello, can you hear me?
Yes, yes.
Hello?
How about, can you hear me now?
Yes, your speech is being translated into French, so that if you can make it a little bit slow, that they can translate it.
Okay. I'm talking about the care. The care has two important parts. One is the healing of the soul. The other is the healing of the body. And the current modern medical practice, we are focusing mainly on the biomedical aspect of illness. So we give more emphasis on the healing of the body than the healing of the soul. Humanities, these are studies that are related to culture, philosophy, and creativity. They are not as such hard sciences like mathematics. They are not objective, and they don't follow specific standards. And recently, there is a movement to introduce humanities into engineering and medicine. A branch of humanities that deals with medicine is, or medical care is, medical humanity. Medical humanities are interdisciplinary field of medicine that are related to humanities, social science, and art. They are very important for medical education and medical practice. Hello?
Yes,
Hello?
we can hear you now.
Thank you so much.
Yes, please could you share your slide again? We apologize to the participant for this technical issue. Thank you.
Hello? Hello?
Yes, you
Hello?
may continue now.
Thank you so much. So humanities, we have, as you can see, the list of disciplines that are included in humanities. And you might be wondered how these disciplines are related to medical care. If you go back to history of human being, really humanities shaped the culture and heritage of mankind. As you can see a prehistoric cave painting, and on the right side of my slide, you see a very prominent dome in the city of Florence. These are old prints of arts of the medieval period and even before that. This is also a slide showing you the Berlin celebration when the two Germans were united and they ran Symphony No. 9, and it was a very big day. On the other hand, the Cleft in arts, you can see Cleft being portrayed as a very negative thing, and particularly in Europe, they used to have the arts that depict cleft patients like subhuman. So they used to, for example, use masks in Korea, and also they were playing a comical role, like people with dwarfism and achondroplasia. Here are some of the pictures that are that shows how a cleft patients were portrayed. And you see the shape and form of a monster child born in Kent. This description would give you the notion that cleft patients were not considered considered in a positive way. The other also sketch is also showing how cleft patients were considered subhuman. And the most important thing that I would like to tell you about this picture is the temptation of Christ in the desert. It was a portrait of the devil. So they made it a cleft patient, a bilateral cleft patient. So this, on the other hand, in Latin America and South America, they used to give a cleft patient a more noble position of the society, as you can see on those two pictures. So modern medicine is evidence-based. It is focusing on physiology and psychology. Best practice is the end result. And also you have to go through the objective analysis steps. Always you have guideline, and if the guideline is not working, it will be obsolete. So there is a challenge in modern medicine. It's highly technologically dependent, and there is a sense of fragmenting the human body into kind of reductionism. So we have this molecular reductionism, shifting patients from subjects to object, and we are focusing on the cure of the patient rather than the care of the human being. Upon this, you have workloads and other issues in modern medicine. This slide shows you that Abraham Vargas gave a lecture, and in that lecture, he pointed out that patients at all time need to be touched and to be heard. And the other story on this slide is the story of Helen, who had surgery, and that surgery is complicated. She was a nurse, and after so many months, the nurses recognized her as a patient in room number 2. So these days, we call our patients not by their names, but by the disease they have. Like, can you bring the coli patient? The other thing is we are really shifting from a hospitable environment to an unhospitable environment. The modern buildings with all their gadget is very difficult for patients to navigate. We have reconceptualized the human body, and nowadays hospitals are machine of the healing. So we are really running away from care and focusing on the cure. So this dichotomy, the dichotomy of art and the science. We used to have art and science at the same time being practiced in medicine, but nowadays we have a disappearance of art and also only focusing on the science of modern medicine. Where is the art of medicine now? Of course, during delivery, there seems to exist a kind of art-like component of our medical care, but it is really not the art that we are talking about. So because of this, we need to have a study of medical humanities in our medical centers. This picture, for example, shows how during that old time, a doctor was really worried and focused on the patients, sharing the empathy and being compassionate and being part of a family. You can see the families are suffering. So during that time, they were not able to have a proper diagnosis, treatment options were limited, but they were empathetic doctors. But nowadays, our rounds and bedside teachings are completely different. So this leads me to why we are really having this problem. Because we are really using our left part of the brain, which is analytic for right hand, the left hand of the brain, and vice versa for the left-handed people. So we need to have really access to the right part of the brain. So in this slide, you can see the different tasks being done by the different hemispheres of the brain. There are different models for the emotional processing, but I'm following the right hemisphere, right and left hemisphere models and the behavioral model. So the right and left hemispherical model talks about the concordance of the two hemispheres, at times working parallel, at different times they will be settled, and their roles would be very different. Sometimes they are complementary. This was Roger Sperry, who won a Nobel Prize for medicine and physiology. He came up with this concept, the concept of the two hemispheres working differently. So as you can see here, the left brain is verbal, rational. On the other side, you have the non-verbal, the intuitive brain. The creative, the emotional part of our thinking is really processed by the right part of the brain. Right part of the brain is very important for natural scientists because they would be emotional, subjective, intuitive, holistic, random, and art and music also are processed mainly by the right hemisphere. Betty Edwards converted this to teaching arts, and basically her book was focusing on how to access the right hemisphere. In training, both brain is very important, as you can see. So if you are running a training program of any level, you need to have the two balances. There should be a balance, and if you balance it, you have imagination, visualization, physical relaxation, and other benefits in a training program. Medical humanities would allow us to understand the human aspect of medicine, and it tries to relate medicine with creative arts, will be insightful and compassionate doctors. So medical humanities can be discussed in four small groups. The first is the medical training. What art has contributed to the medical training? These are paintings that really depicted some medical training programs in the past. Even Leonardo da Vinci had a lot of sketches. These guys, prominent ones, they had also their contribution in art in medicine. William Hunter was also having a lot of sketches, and he was one of the prominent art and educator and gynecologist. Charles Bales, he had a lot of sketches that he did for his students and also for the records. But we can't escape without discussing Frank Nitter. Frank Nitter was a physician and an artist who contributed to 4,000 pictures. These are important anatomic pictures, and he did it for 50 years. He died in 1991. The second aspect is when we want to have a medical training in practice, we need to be competent. We need to have soft skills like communications. We should be able to reduce our stress and burnout, and we should be able to create a person-centered care. So without having medical humanities in our training and practice, it is very difficult to be competent, to have soft skills like communications and the other aspects that I talked about. So medical humanities would allow us to be sensitive culturally of the patient, and would also understand the ethical values. We'll have a mutual respect, empathy, and other important skills that finally would enable us to decide properly. So we can have the imagination, self-awareness, and also we should be able to reduce our burnout. So I really encourage everybody to think about medical humanities in our training program and in our practice. So this was a study done some years back, which revealed an improved observational skill, communication, and also the students and residents had a good feelings and emotions of the patient. And you go back to the history of those surgeons, the educators, they had additional skills like poetry, they were linguistic, they were playing pianos. These are the fathers of modern surgery. This study also shows the importance of increased observational skill for medical students, and also how they could understand the society with the medical conditions that exists. They also would be connected to the craft of medicine. That means application of art and science in medicine. They would be emotionally connected with the patient, and ultimately the patient-physician relationship would be very strong. And they would also understand the full spectrum of illness, the biomedical as well as the biomedical aspect. There are so many studies that showed the importance of visual arts for understanding pathologies and also getting empathetic and compassionate. One probably discipline is the narrative medicine. Medical humanities would serve all age groups from pediatric to geriatric. In mental institutions and pediatric institutions, it really widely is practiced. For example, in pediatrics, they would be able to cope the stress of illness, and also they get adapted to the care environment. For example, music was shown to increase the weight gain of preterm infants, and also children could be compliant in the painful procedures that we do on them. Sorry for the interruption. In adolescents and young adults, as you can see here, they would have improved mood in psychiatric hospitals. They would be able to really come out from abuses of substances, and also in those people who are exposed to post-traumatic stress syndrome, there is a reduction in symptom. There is a tremendous effect of music on our blood pressure and heart rate, and also quality of life would be improved, particularly in non-communicable diseases. People with stroke and other neurological diseases, they tend to retain their capacity when it comes to the visual arts, although they could not increase their creativity. This part is dealing with our hospitals. Our hospitals have three important components. They are institutional, they are highly technologically dependent, they focus on the biomedical aspect. But what we require is, when we are a patient, we would like to have our own space where we would be reflecting our views. We would like to have a cheerful environment which really distracts us from our illnesses. And we should be able to have an environment which facilitates the healing of nature. Big wards in big hospitals, you have a typical picture that I talked about. They are inhospitable hospitals. And because of the inability to address the part of illness outside of the biomedical aspect. So if we are going to humanize our hospitals, we should be able to provide a sense of control and bodily comfort for our patients. They should be able to view and appreciate nature, including light. They should be able to hear a very pleasant sound with a pleasant smell, and the color and the space is very important for them. So we need to make it non-institutionalized. We should avoid large, intimidating, and welcoming environment, rather than we have to really scale down them and separate them between other facilities and functions. We should be able to hide the technologies and prioritize on the nature sensescape, and finally, we should be able to go out of the biomedical. The biomedical emphasis that we give, we should be holistic, truly holistic. So we have even studied character of a typical health institution. We should be also able to introduce also other therapies like art, music therapy, aromatherapy, pet therapy. The list would continue. In pediatric institutions, we should be able to see a resident-like space, and art is very important when it comes to the interior design. Actually, at this juncture, we should be also sensitive for the age of the child. And at this juncture, I would like also to recognize the initiation that was taken by the Smile Train to completely change the ORs that are dedicated for pediatric patients. This part, the last part, is I'm showing you what I painted. This is my gallery, and this is some of my photographs, and these are my references. I would like to acknowledge my family, my wife and my kids. Also, I would like to thank my friends in the art community, Smile Train, both East and West African Regional Office, Federal Ministry of Health, and professional associations. Thank you so much.
Thank you very much, Dr. Untitled. I think that is really delighting type of lectures, and somehow that is what is it's not a normal activities in the medicines. I think most of the participants will have that a lot of questions and arguments. I just want to raise some of the questions. That your talk was that you were talking about humanities and medicines, and the topic was bridging humanity and medicines. So you mentioned that humanity is a sort of study of the society and the culture. So that includes art, photography, mosaics, and so on. And medicine is a study of illness and the treatment. So what is the bridge between this, the humanity and the normal medicine? That is the first from my side. The other thing is that when you analyze that the human brain, you mentioned about that the left lobe and the right hemisphere and the left hemisphere. And the left hemisphere is analytic, calculative, and usually takes a sort of measurements, if I'm not wrong. And the right has empathy, sympathizing, empathy, and also so. So if a person that by accident or something, if a person lose a right hemisphere, part of the right hemisphere, what's going to happen to the person behaviors? Or if that is the vice versa, if a person, the right hand person lose the right hemisphere, what will be the effect? And can you tell us that might explain how this the right and the left hemispheres functions?
Shall I respond to the questions?
Yes.
Okay, the first thing is how to bridge medicine and humanities. This is, you have to, the medical institution should work with the Department of Humanities, where there is poetry, literature, art, and so on. And ultimately, the institution should open up the Department of Humanities, medical humanities. That means you are incorporating additional disciplines and professions that would enable us to see society, to understand the society. I can give you one example. For example, if a physicist comes up with atomic power, that guy would end up in just having the power. Whether to change it to a bomb or to electricity would be the issue of the social scientists. So what I'm trying to say is, because of the inherent nature of natural science, we are really deficient in understanding a society, understanding human being. So without understanding human being and society, you cannot give a holistic medical care. So you should bring those disciplines on board to work with training in medical sciences, also in the medical care. The second question is about losing the right hemisphere. A complete total loss of the right hemisphere will end up in loss of all those important functions like being emotive, intuitive, creative, and also the capacity in art and literature. Thank you so much.
Thank you, Dr. Untitled. If there is, I couldn't see any questions on the either on Q&A and chat. if anybody wants to ask Dr. Article regarding your experience, anything that's not clear, you can unmute your mic and you can ask.
I do have a question myself for Dr. Atakpiti. Being a medical doctor and formerly a medical student, we used to feel really embarrassed to have that creative aspect because a lot of effort is being placed on the scientific training. And so what would be your advice today in someone going to medical school or even residency who actually have a talent, as you have described, that can actually balance that empathic and compassionate aspect of training in our work? What would you give us as an advice? Because now that I'm listening to you, I wish I've heard that when I was in medical school, so that I could also develop those creative aspects that we had, that we actually left behind because we were so focused on the scientific aspect. Thank you.
Thank you so much. I think we should be practical and we should have, I think, two strategies. One is a short-term plan for medical schools. It is very difficult to establish a department in shortly, you know, people in literature and so on, they don't understand also their importance in the medical training practice. So we should create a kind of forum. Then we can plan inviting, for example, students to analyze artworks, inviting literature people to come to the hospital and write a narrative of a patient and share it with the patients. Then with this movement and you know, working together, both groups would understand the mutual overlapping surfaces they have. And ultimately, I think people from medicine should be able to specialize in those fields like sculpture, art, and so on, and reapply it in medicine. Then you will have Department of Humanities, which is specific for medicine. And if you go to Europe and America, most of medical schools, their curriculum is revised. It's revised in such a way that this is incorporated. In some places, it is distributed all over the week. In some institutions, they block it for 6 weeks every year, and they take one of the disciplines, one of the humanities disciplines. It could be art, it could be photography. Then they relate it to medicine. They relate, it is, you know, a window through which you can see the society and the human being. This is really, there are so many studies done, and this is what the result of the studies that we came about. So I think we should now open our eyes and try to go out of the box. That is our science of medicine. One is the books, and we are focusing on the cure. And these days, it's not a problem to have to do sophisticated surgery or to use very nice medicine. And in the Western world, even you don't have to see the patient to do round and decide. It's unfortunate. So we need to come back to that state of mind where we will be able to apply both art and science in medicine on patients.
Thank you, Dr. Article. I just want to add another question on that. Now from the previous audience who asked about having such type of lectures during the medical school. I just want to ask, if a person has the lectures during this lectures or these courses during the medical school, does it really change that person's that having like the skill of photography, skill of art, or is that we are going to extract whoever is having the potential to be part of this humanity? How do you?
Thank you so much, Doctor. Thank you so much, Dr. Abraham. I think you know the current understanding of we humans, whether we are trainable or not when it comes to humanities is different. People are trainable as long as you have the proper tools to access the right hemisphere. That's number one. So when you give these courses, it's not like teaching the Krebs cycle or anatomy of the upper limb, which requires a complete, memorization in soul, maybe dissection in soul. But I can give you one example. If, for example, you hear about patient suffering that is properly written by people from literature, then you will be able to have that state of mind. Sorry. Then you understand the empathy, you understand the deep level of pain of the patient. So the way you conduct the courses is not like the way you give lectures in natural science. It's not also, it may not be lecture. It may be, for example, getting reflection from people. You just show them a painting, they just reflect what they feel. You discuss. So there are different models how to really give these courses, and the course is not meant to give them the actual knowledge, but to have a complete behavioral change. And there is a profound behavioral change that is noticed after the introduction of these courses and revision of the curriculum in the Western world.
Thank you. Anything from the audience?
We do have a hand up by Mr. or Madam Agu. I will let this person speak. Please, you can talk now. Aneli Agu. Hello?
Hello, is that me now?
Yes, you can talk now.
Yeah, my name is Dr. Agu. I'm a plastic surgeon, practicing somewhere in the Middle East now. What I just want to chip in is that in those days, we hear that medical students in England were given novels to read, and that helped to actually improve their communication. And I know in Nigeria, where I trained for my basic medical degree, that they also emphasize communication with the patients and all that. But I like this lecture because medicine is actually losing its humanity. And because of technology, we just treat the patient as a technological tool we use to make diagnosis and then before we start thinking about treatment. So I think we can start by looking at the curriculum of medical students in the basic degree and also the postgraduate level, how we can incorporate some of these wonderful teaching that this man gave from Ethiopia. So that's just what I wanted to say. And then for himself that is in Ethiopia, has he actually made any effort to bring in this knowledge that he now has into the medical curriculum in Ethiopia? Thank you. Hello?
Hello.
Hello?
Oh, yeah, finish.
Thank you.
Can you continue?
So I have finished. Yes, I have finished.
Dr. Asikul, did you get the questions?
No, not fully, but the sound is a little remote, but I think it was a comment than a question. I think he was talking about the medical curriculum to hear fully because of the, it was not loud. Anyone who can summarize it for me or?
Yes. Dr. Agu says that he really appreciates your presentation and that in Nigeria, back in the days where he was training, they used to insist on communication and reading novels. And that's about it in terms of art that they used to have. And as time evolved, he appreciates your presentation in the sense that we need to balance the two. And also he is asking if you have made any specific effort to make those changes in the medical training back in Ethiopia or in any other medical body where you would like to include that art, aspect into the curriculum? That's his question after the comment. I think I got it, Dr. Agu.
Yes, you're correct. That's a valuable answer.
Thank you.
Thank you very much, Dr. Agu. Yes, you are right. It's a good start from you, our friends from Nigeria. Starting with literature, narrative medicine can be the next step, but you have to include other disciplines like use of the visual art, also music and so on, and focus also on not on the students, but you should focus on the patients and also on the environment, the hospital setup and so on. There are also important aspects to be changed. What I have tried to share here from this side is I had the chance to present my products, something like 50 products of both paintings and photography to the medical school I am working in. And they were very much happy to hear about it. And we departed after getting the promise that they would open up the door for humanities. So we had the plan to open up medical humanities in 5 years' time. I think I should go back and do it again. Pertaining to what I did in the COSEXA program is, I was grateful to be invited to talk on humanities in Kampala during the COSEXA annual meeting, and I think there were so many audiences that participated in the speech that I gave. But this is not enough. I think I should pull in people like me who can bridge both the disciplines and work together with people in the social science. So you're right, I have not done enough, but this is something that I should do. I should press and, penetrate the system so that they could do actual things. It requires action. And, if you make it a little deeper, the entry should not be in the medical school. We should create a compassionate society. So compassionate society is created by the input from the family and the school at earlier age. So this concept that we are talking about the human character, society and culture and so on, should be introduced at the earlier age, during the pre-KG time. And catching people at the college level might not be the very favorable moment to have a complete behavioral change. You will have change, but the change will be profound if we catch those people at earlier age. So the ultimate goal of not medicine, but all human fellowship is to create a compassionate society. A compassionate society will solve everything, whether you are an engineer, a lawyer, or a doctor.
Thank you, Dr. Atkelt. If there is no any, I can't see any questions from the Q&A, but I just want to ask if there is no other person from audience who want to talk. But if you take that a person like you, that having this capacity or chance, how do you, is that if I'm going to ask your personal experience, did you get it that from your training? Is that by chance, or is that sort of potential given, or how do you explain this? For some of the people around that in medical faculties are painting, they are writing poem, and they are doing that is what you mentioned from the humanity. So how do you explain without having that any special training, if they have these skills in medicines, including yourself? How do you explain it?
Thank you so much. Let me start by expressing the saying of Leonardo da Vinci. He says there are a group of people who can see, and there are other group of people who can see when you show them. And there are a group of people who cannot see even if you show them. This saying is refuted in the modern world of fine arts. All people can be trained as long as you have the proper way of training them. So you can be trained in playing piano if you have never done it. You can write a poem, you can paint, you can do photography. Everybody has that capacity. It's a matter of accessing the right hemisphere. Pertaining to my exercise or my practice, I used to paint for so many years from childhood up to now, but previously I was interrupting with 40 years and so on. And finally, with an encouragement of my daughter, 7 years back, I started painting continuously and doing photography. But how I relate this of my is just a chance, similarity of training in arts and surgery. So when I dig out, I found that there is a very huge discipline that's called humanity and medical humanities. So I continued reading, and then I found so many studies that are related to the training program with for practice, patient management, and also the physical environment that has to be created for patients. So you have a lot of works outside that really shows that medical humanities is mandatory. If you are thinking of holistic approach, patient-centered approach, if you want to understand the other side of illness, particularly in a place like our country, the third world country or low-income country, patients have a lot of problems. A patient with malaria doesn't have only malaria, the parasite in the body. That individual has so many headaches. And not only that he was the only person who was sick, but also families and friends are sick. So it's better to understand, the human being as a whole, and also the human being in a society. For that, this would open as I said before. If I answer your question. Did I answer your question?
Yes. Thank you very much, Dr. Atkant. If you don't see any person wants to talk, or if there is any additional I think there is one suggestion that I can see that. Thank you, Dr. Atkant. I learned a lot. I thought that medical science and art were not compatible, and this lecture has shown that medical science and art are compatible. That is what one suggestion from the audience. Otherwise, I just want to thank Ismail Train that for just allowing this platform to discuss that extraordinary and that unique type of lecture. And also, I just want to thank Dr. Nina for coordinating these ones. I'm proud to be that moderator for these lectures, and I just want to leave the floor to Dr. Nina.
Thanks so much.
Dr. Nina?
Yes, thank you everyone for participating and listening. I want to say this was a very refreshing presentation, and just like Dr. Abraham said, it is also unique. And what we're doing today is why we are humanitarians. What we call being humanitarian is when you put the patient in the center, the human in the center. And this is also so refreshing. I would like to thank everyone for their participation and invite you for our next series next week, same time, 11 a.m. GMT +1. Please adapt the time to your zone, and note that we continue to have presentation, live translation in French. So invite more people. Thank you, Dr. Atakiti, and thank you, Dr.
Thank you so much.
Thank you all panelists. Thank you.